executive committee meeting for the Poverty and Homelessness Board. And let me review the agenda. We'll have the introductions from the chair, open for public comment. And we'll have James start off with the public comment. And then in public comment, the consent agenda, we'll have a funding update from James, the COC competition update from Amanda, all-in update, the strategic planning update, jurisdictional updates, and then the August all-member draft agenda and a wrap up. Okay, and with that, I will start off with introducing myself. I'm Sean Murphy, the Executive Director of Laurel Hill Center and the Chair for the Poverty and Homeless Board representing mental health. I'll go to my left there.
I am Pat Farr with the Board of County Commissioners, assigned by the Board of County Commissioners. I'm acting as one of the co-vice chairs, excuse me, of the Poverty and Homelessness Board with a focus on the poverty element.
I'm Reagan Watches with the City of Eugene. I'm the interim homeless services manager, and I'm sitting in today for Mayor Knudsen.
Amanda Borda, I'm the senior program services coordinator with Lane County and COC staff.
I'm James Yule, the homelessness and community action manager with Lane County.
And let's see, we have I'd like to acknowledge the board members who are sitting, who are not here online. And then I think, does Kate have a part today?
She's just observing.
Okay. And that would be Kim Lax, Maggie Baggin, and Mike Fleck. Thank you all for joining us as well. And if I missed others, I apologize. And with that, we will open it up to public comment, and we'll let you start off, James.
Well, let's see first if there's any public comment, because mine is separate from public comment. But I don't know if anyone's online to provide public comment. Just raise a hand. So yeah, I just wanted to take a moment to just acknowledge the passing of two of our league members over the last month and a half. We unfortunately have lost both William Schindler and Martha Bryson, who are pictured here on this slide. Both William and Martha were a part of the event we had at the fairgrounds when the strategic planning was happening, and have been actively involved with League for a while. Martha in particular has been a really fierce advocate in our community around homelessness and housing for, I think close to 40 years, and had both lived experience as well as, experience on a professional level working in housing. And so both her and William, it's just a significant loss to our community, to League, to the PHB, and just wanted to take a moment to acknowledge the many things that they've offered to our community as we've moved forward with the goal of ending homelessness. So I don't know if there's other folks that want to say anything about either Martha or William. Wanted to give that opportunity, but I just wanted to mainly make sure we acknowledge their amazing lives in this space.
Go ahead, Commissioner Park.
Thank you. Well, I was looking forward to years of working with Martha because from the day that I met Martha, she's been a mentor, a coach, a guide, and an uplifting leader for my personal progress in terms of the areas that Martha was so knowledgeable about. She gave lived experience accounts that produced results for so many people. She will be missed in person, but she will not be missed. She has left an indelible imprint on the work that we do. And Martha, your family, anybody who may be listening, you'll be with us forever.
I'll just share too that LTD, along with Sarah Koski, Martha was very involved with League and our Project Sanitation Justice, working on bathroom and other sanitation access issues. And so it was sort of timely that Sarah Koski and LTD were working on installing a new water access point at LTD bus station downtown, water refill station for everyone to access water. And they have decided to name that Martha's Well in honor of Martha Bryson. So if you're ever visiting the LTD bus station and want a refill of water, you can honor Martha that way.
Laura wanted to give public comment.
Laura, did you want to give public comment?
Hi, could I just introduce myself?
Sure.
My name is Laura Sky, and I'm a family support specialist at the Riverview Center for Growth. And a lot of what we do is housing navigation. So I'm just trying to kind of get involved and see and learn more information for my families.
Thank you. Thank you for joining us today.
Thank you.
With that, I want to thank everyone and our condolences to Martha and William's families and natural supports at this time. Our thoughts are with you. And with that, I see Mayor Van Gordon just showed up there somewhere on the screen. So it is time to approve the consent agenda. Do I have a motion?
Chair, I move the passage of the consent calendar.
Thank you. I have a second. Second. Thank you, Reagan. Okay. Any discussion? I can't see him. I'm assuming he has not raised his hand. Nope, he's okay. Okay. All in favor?
Hi.
Okay. Thank you. All right, it passes. And then we will move on to the funding update.
Yeah, I think you'll need to pull up a slide here. I had hoped to be able to provide more of a substantial update, but as I know many of you know, we are still awaiting Lane County's allocation from the state. We had previously heard that we should learn that information early last week. And then we heard last Friday that their actual timeline now is 2 weeks out. So we are hopeful we will hear within the next 2 weeks and be able to move forward with our budget. And I know a lot of providers, all the providers are anxiously awaiting that news and that funding. And so just want to acknowledge them and appreciate their patience as we work through this. So because of that, there aren't any major updates on a state level. I did want to share just, this isn't all new information, but just some slides that were shared at OHC, was a MAC lead for the MAC groups related to All In. Again, this is not new information, but I thought this slide kind of more clearly broke out the decreases that we're seeing compared to what the requested budget was versus what finally passed through the legislation. So you'll see that there are decreases in those, in all of those areas, most significantly within prevention. One piece that we learned recently that was not previously on our radar is that in the areas of shelter, rehousing, long-term rent assistance, and eviction prevention, they actually, through the legislature, have made it so that those funding sources will be continuing through to 2034, pending available funding. So that at least is one plus, in what has been somewhat of a disappointing funding news. That at least is one benefit that we can see that there is an investment for long-term supports in those areas. We're able, moving forward with contracting with, partial allocations when we, have reason to believe the funding will be coming. It's just a matter of time of waiting. And so we are moving forward whenever we are able to, but continues to be a bit of a waiting game on both the state and federal level. Any questions specifically about the state funding before Amanda covers an update from HUD?
Commissioner Hart?
Thank you, Chair. I'm going to say that yesterday at the Mental Health Advisory Committee, we had a very extensive report from Vanessa Cornwall, our our chief lobbyist in Salem, and a very extensive report, covered all of the information that you see on the screen right now and a great deal more. That report is available, and I'll send it to you, James, so that you can forward it to members of the Poverty and Homelessness Board. It is pretty comprehensive. And one thing that came up at the Mental Health Advisory Committee, and this is a good time to mention it right now, is that our agendas and our interests between that committee and this committee are overlap. In fact, at many times they're just concentric. I mean, they're the same issues and agendas. So sharing reports, sharing some information, and occasionally sharing agendas and strategies, I think is something we could consider for the future between the Mental Health Advisory, which is also our local Drug and Alcohol Policy Committee, and this, the Poverty and Homelessness Board. Nothing more to talk about there right now, but this is a good time to talk about it, because looking at the funding from the legislature, we're looking at it with the same sets of eyes for the same reasons, because we serve the same people in the two different committees quite often. It's the very same people. So thanks for that indulgence.
We are reading a question.
Chris, I'm not sure I'm understanding the question, and I do want to just be clear that these are state funded. This is the state information, and so specific questions about how decisions were made by the state. Your guess is as good as mine. So
if I may give a clarification,
yeah,
James.
please do. Go for it.
We were told that first comes first, that all pre-existing projects would be funded, and if there was leftover money from, according to the state, that would go to any other new projects. However, we were told that the state had more monies and that we were not getting less than, given that they added approximately 25 million more to the shelters only project. In fact, it's the first time in my known history that shelters did not lose money for some of the rental and other items that were provided, but that if there was any disparity, such as the City of Eugene's $3.9 million item, if we were supposed to be losing money, that it would be because there wasn't enough to go around for all the projects. However, we were told that there has been local regional projects that have been funded from this money or will be funded from this money that did not actually exist in the last all-in go around. And so I'm just concerned that the people who have been serving are getting less than, while other projects are surfacing from the same money, when we should be able to thrive, not just survive. I yield.
Commissioner Burke.
Thank you, Chair. And I can, Chris, I can provide you with a partial answer to that. The funding that's coming through after this legislative session is a pretty complex cocktail of funding, some of which is directed into very specific areas. And though the net amount of money looks like it is more for shelter and housing stabilization in general, is being allocated to some very specific areas. And it's not always done on a formulaic basis. So we don't always get our, 1% of the formula for Lane County. Not 1%, we get 10% is what we get for Lane County, excuse me, not 1%. But we don't always get that much, Chris. You and I can, I am way overdue to sit down and talk to you about some other things on our agendas, Chris. So let's get together next week, perhaps, and I'll go through the specific bills and we can point out, what is allocated to where. For instance, House Bill 3644, the statewide shelter program, which is the governor's office bill. I don't know where the details of that are going to actually lie as far as the actual administration and the outcomes. So we're still, I think, most everybody is still waiting for the outcome.
Yes, sir. And I do respect, Mr. Vice Chair, that information, and happy to meet with you. I just want to say, when we reached out to OHSC, they said, just like with the breaking of funding last time, that this was a regional decision, not the state decision. And they don't understand why certain changes on the regional level have been made, because they said the governor was quite clear. I will yield and look for further conversation from you.
Well, and the last thing that I'll say about that is that last Friday we had the Local Government Advisory Committee, which is the OHA, OHSC, and AOC. That's Oregon Health Authority, Oregon Housing and Community Services, and Association of Oregon Counties. It's a committee that I chair. Director Gray is on that particular committee, and we had a very deep rundown of state funding and the bills from OHSC. from the director was there. And so we have some really, we're not talking through channels with the director, we're talking directly with the director, Chris. And so if you have specific questions, and I won't beat this any further, then let's get those specific questions and I will have the director answer them specifically for you.
Thank you, Mr. Vice Chair. Thank you, Madam Chair.
Any other questions or comments before we move on? So then we will turn it over to Amanda, the COC competition update.
Sure. So I think everyone in the room might be aware of what's the update, but for those joining online and through the public, we had initially thought that this year we would not have to do a full continuum of care competition like we typically do annually because we received a fiscal year 24 and 25 notice of funding from HUD last year. So it was supposed to be a 2-year competition, which was a welcome change. To not have to do that whole process annually. We have since learned that HUD has notified us that they will actually be issuing a new fiscal year 25 notice of funding. And so a new NOFO, a new competition this year. And some of the language included in that notice included new priorities, including an emphasis on treatment and recovery, an emphasis on addressing unsheltered homelessness and reducing returns, as well as emphasizing increasing employment income. So some of that is not in line with previous priorities that we've really emphasized, like housing first. However, we don't really know what that will look like until we see the notice and really how those priorities are coming out from HUD and how they'll really emphasize those in the new funding. And so we don't know what impact yet that will have on our existing projects or how we will have to prioritize. But what we do know is we'll likely have to do a ranking of our projects, which we did not anticipate. And so our COC committee of this board met this week. They've just concluded the evaluation process. We did a past concern sort of easy evaluation this year, or a light evaluation. So we didn't score everything that intently because we thought we would not have to do a ranking. So they're aware that we're going to have to revisit that process once we receive the NOFO and reevaluate how we prioritize and rank projects once we know more from that notice. So that's really the update for now. We're hoping to receive that soon. It's either probably July, end of July, or early August, I would imagine. But we don't know when, and we don't know when it would be due, but it's typically before October.
Sorry. All right, and do you know if we've reached out to the providers so that they know we're on this new?
So yeah, we sent that in an update to we send out monthly COC updates, so they've received that. And the other thing I didn't mention was in that notification, they mentioned that there would be opportunities for additional new projects like street outreach and transitional housing, which also have not been funded under the continuum of care. So that will be something new, and we don't really know what to expect of that either.
Great. Any questions for Amanda? Thanks for the update. Hopefully you and the committee are doing a lot of self-care. Just like just when we think we have we don't have to look at this for a little bit, then it's like, oh, nope, we're wrong. Yes, we do.
And I imagine we'll have to bring some things to this board or to the full board in the next few months, so.
Thank you. All right. With you, James and Nolan.
Yeah, so this is another agenda item. I had hoped to have had more information to be able to provide, and you know, with still waiting for the local allocation, there's not as much to share here as I was hoping. I did want to just touch on a few things though relating to All In that may be news to this group and to folks that aren't actively participating in the MAC group. One piece of information we received recently is that street outreach funding this year is actually under the same umbrella of funding as emergency shelters. And so with, you know, our intent and our goal to sustain all of the shelter beds that were created through the executive order, you know, we'll have to wait and see how much total funding is allocated under emergency shelter to determine if there will be funding available through it all in to be able to, again, fund a street outreach project. So as that funding allocation comes out, we will address that once we have a clearer picture of what the funding is available. The long-term rent assistance program that has been, initially it was in round one of All In was just referred to as rehousing. Then the state implemented the long-term rent assistance program with the intention of being able to maintain housing for those rehoused folks on a long-term basis. The state let us know last week, the week before, or let Mac Group Regions know that there was an opportunity to move away from the program administrator model that they had been requiring. So there had been a requirement that started in January of this year that there be a dedicated program administrator for LTRA. So that's an entity that would be responsible for issuing the rent and utility checks, for doing the inspections, the required inspections, income calculations, verifying fair market rent, et cetera. So all the administrative pieces. And that entity in our community has been Homes for Good. In presenting to our providers that there was an opportunity to submit a request to move away from that model, all of those service providers and actually ultimately Homes for Good as well were in support of us submitting that request, recognizing just there's been some challenges around timeliness with being able to get rent checks out. Beth Oaks from Homes for Good, was transparent that it's incredibly difficult for Homes for Good as a government entity to be able to quickly turn around, get out rent payments, and especially when there's late notices that require payment within 72 hours, et cetera. So that's been the primary challenge. So just wanted to update this group that on behalf of the MAC group, I will be submitting that request to the state tomorrow, and we'll see, if that gets approved or doesn't get approved, but that will potentially have a change to how the LTRA project is operated. And then, as I previously mentioned, we are, moving forward with contracts as we are able, as we have the funding and budget pieces that we need, but recognize that this lapse in between contracts periods is incredibly difficult for providers. So just again, want to recognize that and appreciate all the folks that are living in the gray area and unknowns right now. That's all really I have as in relation to All In. I, again, was hoping to have some more clarity that I could provide this group, but can bring that to our next meeting. Hopefully we will have further information, but happy to answer. I know there were some things popping up in the chat. Any questions, All In specific related questions or things folks would get? Oh, go. You're the
Go ahead, Regan. I saw your hand out of the corner of my eye before I said something. Go ahead.
My question is about the outreach coming under shelter. Do we know where approved outreach funds from the state currently are located? Is it in the rehousing bucket? Like, where was that approved in the, this much for shelter, this much for?
My understanding is it is in the rehousing. I'm sure Kate will, if she's present, will correct me, but my understanding is yes, that it's currently in the rehousing section.
So we would see.
I could be wrong.
Okay.
I can offer that it was its own bucket, that it was an independent bucket of dollars. And so that moved away. There was also a unit access bucket of dollars that is no longer as well. And so positively, outreach is allowable. And we were worried. We didn't know if it would be allowable, period, among the different funding sources that we're receiving this fiscal year. And it is challenging because the shelter bucket has a finite amount of money. And we're expected to sustain the number of shelter beds from the last fiscal year. So like James mentioned, we need more information to understand what the future might hold.
Okay, but at this point, we're not expecting to see that shelter number go up because it's absorbing outreach. That will probably stay the 205 million. Is that what you're thinking?
Yeah, I mean, the fact is we have no idea how much money we're going to receive in shelter funding at this point. So that's the number one piece of information we need next.
My question was, I missed it. The long-term rent assistance, did you say we're opting to decentralize?
Correct. Yeah, sorry, I wasn't super clear there. So yes, the interest among the service providers is to go back to the model that was being used in round one, which is that each service provider is responsible for the program administration for the households they're serving. And we will work with Homes for Good on a transition plan. We certainly don't want to leave Homes for Good staff high and dry. They're clients that are going to need things paid, as we work this all out. So there will be if approved by the state, there would be a transition period.
Any other questions or comments before we move on? James?
This will just, I won't talk much here.
You actually have time if you want to.
Well, I'm hoping this will become a robust conversation amongst the board members regarding the strategic plan and the prioritizing of strategies in the upcoming year and the creation of the subsequent work plan. So I'm going to give what is not new information, but just a recap of the previous work that has been done to identify strategy, what the board wants to prioritize moving forward for this first year of our new strategic plan. So as you may remember, we engaged the public in a few different ways. We had a drop-in event at the fairgrounds. There was also a survey that was accessed through a QR code. Those were presented to community members of this board, league. We also had that available at what was called the Classy event, which was a conference that we held for users of our HMIS system. And we had over 36, I think we actually ended up with over 40 responses to those surveys. And the goal was really to look at the core areas that are within the strategic plan and identify which of those the board wants to prioritize, and then within those areas, which specific strategies. So the two core areas that received the highest votes in that surveying was the shelter and housing sustainability and advocacy was the highest, and then poverty and unsheltered homelessness crisis response system was second. Within those core, I keep moving this thing around. within those core areas, within the shelter and housing sustainability and advocacy strategies, the number one strategy that was prioritized by respondents was to advocate for income-based housing and innovative housing solutions countywide. And then within the poverty and unsheltered homelessness crisis response system strategies, the number one was to transform the unsheltered homelessness and encampment response. So I recognize too, these are somewhat broad strategies. I think the opportunity lies for the board to once priority has been given to a certain strategy, would then be to work to create the work plan that an ad hoc committee or one of our existing committees would then work to move forward the actual pieces that fall within that. Digging a little bit deeper, and this is getting more into the specifics of each of these. Under the shelter and housing sustainability and advocacy, this number 7 strategy was the highest among survey respondents, which was advocating for local and statewide efforts to prioritize affordable housing and set our attention on the needs of extremely low income and homeless households across Lane County. And then for the system level, it was 2 that were voted the highest. First being to work with first responders and law enforcement to reduce practices that penalize people for experiencing homelessness. And then number 10 here, which was working with local officials and people with lived experience. I'm having all sorts of problems here. To engage with community groups to identify agreed upon spaces that will be safe, accessible, and available to people experiencing vehicular homelessness and are supported by the local community. So as, I know this group has been reviewing, has seen these strategies and priorities before. What came up as we were working to get approval from this board for the strategic plan had several conversations with board members that highlighted the fact that these strategies were created outside of an awareness of what the funding picture was going to look like for this fiscal year and beyond. And these are obviously very lofty goals, which I think they should be for a strategic plan, but there is that piece of needing to be able to connect the goal with the reality of what the funding is. So that's why we're revisiting this and hoping to have a conversation today with members of, do these still make sense as strategies to prioritize now that we have at least a little clearer of a picture of the funding? Does the board want to move in a different direction as far as strategies, prioritization? And then ultimately, the hope would be we will come out of this discussion with, a handful of strategies that the board wants to move forward this upcoming year that will then help to guide the creation of the ad hoc committees and the work plans for those committees. So I should have given that context at the beginning of the conversation. I'll go through these some of them because I know they were sent out in the packet. These are the highlighted in red, these are the other strategies that were prioritized through the surveys. And recognize this is a lot. And so we would look to the board to pull out, like I said, a handful of ones that they would like to have the committees work on for this upcoming year. I think I have one slide at the end that kind of, so in relation to those committees and ad hoc groups, these were the committees on the top are the committees that will continue, that are required for RCOC, and then these are proposed ad hoc groups based on the strategies that were prioritized. These are simply suggestions. These are, open for the board to weigh in on and to determine, but based on the areas that were prioritized, these are kind of the broader umbrella topics that seemed of value. One that I believe came out after we talked about this last time was specific to a strategy around prioritizing a subpopulation through coordinated entry. And using the Built for Zero model. So it's this number 6 here under the shelter and housing sustainability and advocacy. It's implementing the Built for Zero model for families who are unhoused and then expanding the initiative for additional populations. I've been with the county now about 5 years, and Built for Zero has been, a model that we have utilized heavily in our coordinated entry system, in our data system, HMIS. I think what we haven't done is done a prioritized population like their model suggests doing. So that was another piece of feedback that came through the surveying that was, I think, added after we last talked about all of these. So that's a ton of information, I recognize, all of which is in the packet, would encourage you to review. I think, in having the conversation with the chairs in preparation for this conversation, it's really looking to you all to, confirm that these prioritized strategies still make sense in light of the funding landscape, or is there a pivot that needs to happen? And if so, what are other strategies that folks want to see us move forward with? I think I'll leave it at that and turn it over to the chairs and to the members to talk through any of that.
Discussion.
So to frame that a bit, thank you, Chair. To frame that, James, we have what you described as lofty strategies and goals based upon them being made outside of the full reality of the funding available. And so what we'd like to do is narrow it down to things that we can perhaps feel that we're going to have progress toward this year, that we can report progress, and that people feel a sense of accomplishment rather than a sense of frustration that we're simply not able to do it because we can't address it with the funding we have. So I'd love to hear what jumps out to people as things that we cannot avoid doing, whatever the funding picture that we have to put our resources into it, and claim, beg, and scrape for other resources to make it happen.
I do support that within, and I think we've had this discussion before about what the county with the Poverty and Homelessness Board funding, what they can do, and also how we're going to add to the strategic plan of how we're going to reach out to other community partners and how they can help move forward the strategic plan, even if it's not necessarily with the Poverty and Homelessness Board funding, because this board has a limited amount of funding that we would have oversight for. We don't necessarily want to drop the strategies because this is what the community has said is important to them through their feedback, but it also means we can do this portion as the Poverty and Homelessness Board, but that we're making efforts to do outreach to other community partners who might also be working on these things and how we can bring them together to give feedback to the community, maybe even through this board of all of these things are being worked on in the community. Maybe not all of them are being worked on specifically through the PHB. And those that aren't, that we're reaching out to those other entities and having them come in to bring in what it is that they're doing towards this overall community strategy, because this was from the community, and I do think everybody and all entities will be working on this. And so it's how do we bring all of that together? I say PHB is doing this part, but there's other entities that are working on other pieces where we might not have the bandwidth or the funds to do that, and then bringing that back in to say, this is also contributing to moving this full strategic plan forward. And I saw Chris and Reagan had their hand up. And Maggie. All right, you're gonna have to help me too.
I think Chris had his hand up first, and then Maggie had put the comment in second, and I don't know if she wants to follow up with any additional context, and then Reagan, I think.
Okay. Chris?
Thank you, Madam Chair. James, I just want to share that as we go through the strategies, a lot of the community structure does not know what we as contractees or participants in the safety net for Lane County have to do. Being low barrier, high risk, I have had to take on for the last 4 years people who phased out of our short-term medical fragility system, such as the Peace Health pallets or the shelter care recuperation center. So we have hundreds of people in this community who are supposed to have a follow-up with 1 to 2 weeks with a doctor, yet we have no access to doctors as new patients in this community are sometimes being told, as of yesterday, January is when you can get your next new patient appointment. And so we have people who are not able to get their meds adjusted, not able to get the tests they need, are borderline terminal if they don't change their lifestyle or their medical regime right now. And we're being told that mental health care and medical care for our indigent population are in the hands of the county. How does this body advocate to the behavioral health program and to the community healthcare centers to be able to get the care that needs to keep these folks alive? Because everybody's housing first, but their health is second. And so when they die within a month of getting into housing after a 2-year process, that's not really a win that I want to stand behind. And so I've had a wonderful time working with Dr. Barry of the FIT group hosted by the county, but they have to have met certain criteria to meet that need. And there's not shelters for the people who have those high level needs. So I just want to put, as we look at the strategic plan, a lot of the community partners don't hold the load that Shelter Care, St. Vinny's, Everyone's Village, Equus, The Mission, Carry It Forward, CSS, their Opportunity Village, everybody who is doing the hard work right now with people under the low barrier, almost no barrier pretense as set by funding. I don't know that we're being holistic or weighing our vote as necessarily as we should. And so I yield.
Thank you, Chair. And Chris, I'm going to respond to you directly. You said a lot of words there, but you got a couple of very strong points across, and that is that quite often the priorities in the strategic plan of the Poverty and Homelessness Board, which does have some resources, is not known by some of the agencies and entities that we do work very closely with and or overlap with. That's one thing that we're talking about right now, is how do we leverage our priorities and our strategies with the other agencies who are not necessarily funded by Lane County, not necessarily funded by the Poverty and Homelessness Board, but that do have a similar mission. And one way that we can do that is something that I talked about, and pardon me, Reagan, I know you have something to say that's very important, but that I talked about earlier in the meeting is our strategic plan, which is highly vetted, is highly supported, and it has a great deal of support throughout the community, and it's multi-agency and multi-jurisdictional. Our strategic plan should be and can be of interest to other bodies if we make it available to them, because I'll cite what I talked about earlier, the Mental Health Advisory Committee. It's a statutory committee. It's once again populated very broadly, both by professionals and by lived experience individuals. And our plan, if we overlap our plan into their meetings, then we'll find that some of the things that we are interested in are things that they are doing that really contribute to the success of our strategic plan without us putting it direct resources from the Poverty and Homelessness Board, just coordinating our efforts. So Chris, what you said, I've heard, and I think that is an area that we do need to focus on, is how can we leverage our strategic plan in other agencies and jurisdictions to make certain that without the funding directly from us, we're still doing the same things with the same goals in mind. And I hope that kind of captures what you're asking for, Chris, because that's the direction that I really would like to take us.
And can I just quickly, I think that the point, Chris, around the low barrier model, we are, as the COC, tied to the requirements of the funding source. And I think, when you look at the no-flow messaging that has come out recently, there could be a move away from HUD for Housing First, and that would mean our COC would need to follow suit with what's required of the funding. So I think just adding that piece, that there is requirements of the funding that are out of the control of the COC.
But if I may, James, that really contributes to the fact that the funding itself has strict limits and strict, and it's getting even stricter how we can allocate it. That doesn't mean that our priorities can't remain the same, simply because HUD's priorities are changing. Ours don't have to. Just the way we spend HUD money changes, but the priorities that we have, which are very well vetted throughout the years, and we know that Housing First works. We know that Housing First works, but we can't necessarily give the data that HUD asks for to demonstrate that it does work. So they're going to spend the money in other areas. So that being said, we can still do the things we want to do, just have to make sure that we're not cross paths with the funding sources and trying to spend money that's being sent for specific uses on things outside of that use. So our strategic plan is good. It's valid. And even though it's not necessarily supported by the federal government 100%, it is supported by the people who live in this community. And we have to highlight that, and we have to shine a spotlight on it.
Reagan?
Just to kind of piggyback on what y'all are saying too, it does look like one of the priorities that is in the slides around public and community health system connections is to engage or establish this systematic coordination across medical, behavioral health, and homeless service providers. So it just feels like that speaks to the issue you're bringing up, Chris, and a potential pathway for this group to work on it. What comes up for me in this discussion, the question you're posing is kind of the structure for which we do this work and then the process. And it feels a little backwards intuitively to me, but it also makes sense to I appreciate that there's some ad hoc groups proposed and that there was, a connection of each of these priorities pulled out to which ad hoc group they would fall in. But because there were so many strategies in the plan, it's 101, I think I counted. It's hard for me to dig into the details and be like, oh, we should move off this one and move to that one because I don't have them all in my head. So I wonder if it makes sense, even though this maybe feels a little backwards, I feel like the proposed ad hoc groups are pretty good. And maybe there's vetting that happens within those groups of going back to the strategies that have been assigned to them, looking at the funding and the role and capacity of the PHB And just doing that additional layer of vetting, of saying, are these the priorities? What are the benchmarks that we feel like could realistically be hit and when? And then bring that back to the full board, maybe as a pathway to go. And then, you know, the other thing that occurs to me is in the plan, there's these systemic goals that were on page 12, and just kind of crosswalking the priorities with those goals and how, you know, what is being worked on is helping us achieve those goals. And maybe these goals need to be adjusted at some point, depending on the funding.
My thought was listening to the conversation of, we have the priorities and there's funding. So funding is always one. And then what is it that we can do administratively or system-wide to make changes? And as we're going through the priorities and looking at that, I think it's having those conversations of like, these are the things that we know as the funding comes out that we can actually make some fundamental changes. These might not have funding, but maybe we can look at the structure in our system and partners and how we can work together. So, because Chris was talking about the behavioral health, the behavioral health and those pieces and the shelters, and it's like, well, neither behavioral health or the shelters might have the funding where we can build new programs, but within the Poverty and Homelessness Board, and I know we've talked about this before, we've even done some of the work with domestic violence about how we can partner and support agencies partnering together. And so how can, you know, shelters and, you know, health providers work together, even if there's not necessarily the funding to build a whole new program, which is something that could be a strategy that we could work on to address that without necessarily having any extra money to build something new. And that might have to be, that was my thought of how we would approach the strategic plan on a yearly basis and these tumultuous times of funding and priorities that can change from, well, yeah, year to year, I'm going to say. That's kind of where we're at right now, because we just don't know what's going to be available when. And I think, like Commissioner Farr said, that does contribute to people's frustration when we have the priorities and even ours, because this is what we would like to work on, but we just can't get everything to align in time. And so we have that flexibility of knowing this is the funding, and then here's some things we might not be able to build, but we can do internally. Some might be moving by small steps throughout the strategic plans, and then sometimes things would take bigger leaps.
You know, if you watch Major League Baseball, I'm going to use an analogy here. We're swinging a fastball and we're being thrown sliders and curves, and we're missing the ball. That's a weird analogy, but we hope we had what felt like a stable stream of funding that right now it's been halted, and consequently we have to find a new way of looking at it that's going to still incorporate the priorities that we have that we've put forward, the strategic priorities that we put forward, because we can't afford, not us, but the people we serve can't afford for us to not go forward with this plan, and they can't afford for us to just sit and watch simply because HUD and other funding agencies have changed the way they're sending them, the way they're throwing the ball to us. So, and in order to do that, we have to enlist the people in the community who are doing the same things that we are, who would love to be a part of our plan and love to be able to contribute to it, if only they knew that they could, and they are. And so I think that's a good strategy for us moving forward, is to incorporate other groups. And then once again, I mentioned one that I work with, Mental Health Advisory Committee. Another one is the MAC group, for that matter, the very specific priorities of the MAC group, which overlap concentrically. I mean, it's the same. And we have, sometimes it's the same staff, sometimes it's not the same staff. And sometimes if we ask different staff members to do things that another staff member is doing, it sounds like more work, but it really can be a consolidation of work that make it easier to get the strategies. So that gives me a level of optimism, James and Chair Murphy, that we can move forward, even in this uncertain time that we're in, uncertain funding time. We still can move forward the things that we've set out as our priorities.
Thank you. And then I see Maggie, I know you said you were going to come out loud, but about the long-term supports for folks to be successful. And yes, that is very important. I think in looking at that, I think there was, I don't know, wait a minute. Go back. I thought there was a surprise that there was some supportive housing funds approved in the state
Yes,
budget.
there
that
was.
Everybody was like, oh.
Yeah, under the Christmas tree bill, there was, I want to say 15 million that was included for permanent supportive housing that would go to, to those focus areas.
Yes. So, so that was great to hear. Of course, we don't know what parts of what that would look like, but I feel like that's the piece of like having the strategic plan and looking at what's coming out and having that flexibility to be nimble. So, because if that funding is available, that might be an opportunity for like what Maggie was pointing out of the potential. Well, we didn't have it as like a top priority on the agenda. It's like, oh, here's this funding. We have an opportunity to use it in those focus areas. Any other?
I just have one more thought. The other thing that comes to mind is the revision sort of relationship between the HSC and the PHB. The HSC is supposed to develop an agenda or work plan or something that leverages support for this. So that I'm just wondering if there's thoughts that maybe you all have about, because this is there's so much in here, like where we can maybe proactively try to think about where the HSC's work situates itself in moving some of these forward. There's particular strategies or something, or how we see that sort of process working now that we have a plan, how we envision the HSC using this to inform their work, if that makes sense.
It does make sense. I'm not sure if I know this group has talked, I think as a part of these conversations, there was conversation around, does there need to be some sort of formal interchange between the HSC and PHB, whether that be, a member that sits in on, each of those meetings. I'm sure Kate will have things to add. And I know it's actually not on the agenda, but at the end of the meeting, wanted to highlight a joint meeting that will be happening in October with HSC and PHB. So yeah, I certainly think there is opportunity there for sure.
Go ahead, Kate.
I also offer high level, thinking about the HSC, few of the priorities are very much around advocacy. And there's significant advocacy opportunities, especially even looking at the conversation around prevention. The amount of prevention assistance allocated for this biennium is incredibly less money than the last biennium, down more than half of the available dollars. And it is going to be, unfortunately, very negatively factored across the community. And so that's an example of where, additional advocacy could be a strong opportunity, as well as identifying additional funding options for the plan itself. As Sean mentioned, the dollars coming in from the state and the federal government and even the HSC itself is not nearly enough to support the enormous needs that we have as a community. And so, one of the focus of the HSC is how can we, garner additional dollars to support the work that's needed. And so I think those are two key focus areas for the HSC, as well as potentially where the local jurisdictions could help meet some of the needs that exist.
think one of the things, since you're on the Mental Health Advisory Council, that maybe at some point we would be able to put them on the agenda as well, because they will also be impacted by changes in funding. And then we know who's going to be eligible, the impacts that they're saying, or what's going to happen to the Medicaid population as the new changes go into effect about redetermination and all of those pieces, which will probably mean there's a chance we will have a significant increase in folks who do not have access to healthcare and services because they will be under or uninsured. The potential is there for that rise. And I know that's not with us as the Poverty and Homelessness Board, but it might be important for us to understand because that will have an impact on the services and the things that we do and our service providers as those pieces come down, because it's already pretty strained.
Absolutely, and Brittany Deliso is the new chief staff person for MHAC. We all know Brittany; she's been around a long time. Not a long time, but she's been around doing a lot of important issues, including Stabilization Center, which is something that she's been the lead on also. And so many of the things that we talk about really it's the same conversation with just a slightly different bent to it. And Brittany has already, and I think she's already expressed this to you, James, expressed an interest in consolidating some of the work that we do, not to overload either committee, but to do exactly the opposite, to help realize that if they're doing it, we don't have to do it, but we can observe it and give input as they accomplish some of the things that are important to us. And it's not just MHAC. There are other committees and agencies out there who are really focused on the same things that this committee is focused on, that we can actually take as successes as they contribute to and check some of the things off of the list of our strategic plan.
Yes. Yeah. Thank you. So, and did it end up being as clear as mud, Jim?
I was just gonna say, if we could have maybe like a little recap of, as far as next steps. You know, I know staff are eager, related just to the committees to kind of have some guidance and know. So, I mean, what I feel like I've heard is there remains support for the strategies that have been prioritized, looking specifically for opportunities to partner with other entities where we're able. And then Reagan, your idea, which I think was a really helpful one, was to kind of take those to the committees, kind of go with the committees we've identified, take those to them and have them look at it through their lens and kind of bet of what they see as doable within their capacity. Is that?
Yeah, pretty much. And then maybe by that time, if we have more word on dollars, you know, factor in what are the factors that will help those committees solidify the strategies and priorities they want to focus on.
And I do think within the 102 strategies or whatever the number that you said, I do think there are several of those that are low-hanging fruit or things that there's already been motion made on. And so I do think that also would be helpful. You know, those committees may already be like, those are things we, you know, almost have done and just got forgot about or whatever. So I think there is an opportunity to identify those strategies that are more easily achieved as well.
Okay. I like the proposed committees. So, and the ad hoc groups. I think the ad hoc groups that we have are broad enough that it can cover a lot of territory. And so we don't end up with, I think originally when we were looking at the strategic plan and the first proposal, I think there was like 12 or 15 different groups within that. So I feel this proposal makes it doable.
Yeah.
James, you asked for kind of a recap to give you more clarity. Did that help a little bit?
It does. Yeah, it does. And if there's other folks online that have any, you know, clarity or additional comments they want to make, that would be helpful. But yes, that does.
And while we look at that, and I'm going to look, since Reagan's right in the room, and Reagan, you are City of Eugene in the room today, and Mayor Van Gordon, you're the City of Springfield in the room today, not in the room, but you're with us today. One of the proposed ad hoc groups is cross-system collaboration and resources. Now that is a mouthful, but what that means to me is particularly our largest drivers in the county, the two big cities, the City of Eugene and Springfield, having cross collaboration, which maybe this is the means to do it. I think this is a way to really leverage the work that we do and have the things that we do maybe check off other people's boxes, and things that they do check off our boxes, which gives us a sense of accomplishment without really expending any further resources. So I think that the work between Springfield, Eugene, and Lane County, not to discount the rural part of the county, but really, a lot of things happen right here, is important. And I love the cross-system collaboration and resources ad hoc committee concept, if that is what we're thinking about. So I'm with you, Chair. I like the committees and the proposed ad hoc committees.
Yes.
And Reagan, I was looking at you, not to embarrass you, but just to kind of reinforce what you're saying.
Okay. So Chris, we saw your comments, and we'll make sure to add that into the discussion as we move forward, to make sure we definitely hear that there are some people that are struggling, and there's some specific supports and resources that service providers and individuals need that are not available, and that part of all of our work, and even across the ad hoc groups, is that as we're developing these strategic plans, that we're looking at how it supports people across the continuum. So that we'll definitely be looking at that and across everything, that when we're making programs and recommendations, that we're looking at the whole continuum of individuals and programs who need support. And with that, look at us. We are actually.
Some of those agenda items were shorter just because we didn't have the funding updates.
Right. And then with that, we are to the jurisdictional updates. Do you have any?
I do, yeah. Just a few updates. On May 28th, Eugene City Council had a work session to review the 2-year HIP report, which is a reminder that's the housing implementation pipeline, which is a cross-departmental 5-year work plan to coordinate current and future city resources, goals, and priorities for housing, using a systems thinking approach. And it looks at the full continuum from people experiencing unsheltered homelessness to all the way to market rate housing and overall housing supply. So basically, council got a 2-year report update on that, and folks can find it on the city's website if they're interested, the meeting and the materials, as well as the HIP itself. Also on June 9th, council approved the use of $700,000 in affordable housing trust funds to support the creation of 205 new affordable homes for low-income households. You can find information about those it was 205 new housing units among 3 different projects. So you can find more information about that on the Affordable Housing Trust Fund webpage. Also, just want to note there's an opening on the Affordable Housing Trust Fund Advisory Committee for a housing and population advocate representative. So that would be people such as people with experience as an affordable housing resident, housing advocates, Human Rights Commission members, and the applications are due August 18th. And There's also a city request for proposal open, RFP open for system development charge exemptions for affordable housing development. And those applications are due September 10th. Information about all of that is on our webpage, or I'm happy to direct people as needed.
That is big, Reagan. Wow.
Commissioner, I'm gonna let you go next, and then I'll call on Mayor Van Gordon, because I saw his face and then he's gone.
No, I think, oh, there you go.
Oh, you know he's there, okay.
If Sean's ready,
Okay, are you ready, Mayor Van Gordon?
I could go real quick. I don't know that I've got a lot to offer since we've been on like the council's been on its summer break, but we are, you know, working our way through the summer as quickly as we can, like everybody feels like. But I did get you know, an update that Cornerstone Community Housing is planning its ribbon cutting for its affordable housing property that's over on about Q and 16th Street. So that's going to be coming out in the fall. But I will have more when we get into the fall.
Wonderful news, thank you.
First off, I'd like to say, Mayor Van Gordon, why don't you just read the article that was published today in Lookout Eugene? Because that was spot on. It was impeccably written, and the things that you talk about in that, we should all write down and stick it on our fridges at home, because it was that well done, Sean.
Well, thank you. You're too kind.
I'm not even close to kind enough, and you've seen me at football games, so you know I'm far less than kind. So that being said, the one thing that's really percolating right now with the county is the stabilization center. We have on Tuesday of next week, we have an executive session. We'll be talking about real estate. Now, I can't go into any more detail about that, but it's we're narrowing it down to the final selections as to where. We have and I won't go into too much detail because I'll just confuse and or mislead you if I do. But the funding is beginning to solidify in place. And so keep an eye on next Tuesday. We'll have an executive session. You won't be able to hear what's going on there, but on Wednesday, we'll come out into a public session at 11 o'clock time certain on the stabilization center. I'd like to invite people to take a look at that or look at the webcast of it, because we'll hear things that I've not heard yet, that I've personally not heard yet, and we'll start to solidify some of the direction that hopefully will soon get us beds available for people who need them in a place where we can use them, where it's not going to affect the surrounding community. So that's a big deal. The other thing is the navigation center. Our River Avenue Navigation Center has been, on Tuesday, we'll be reissuing the contract on that for this continuation. I'm presuming that that's going to happen. We put a 2-week hiatus on it in order to address some of the neighborhood concerns that have been raised by people in the neighborhood regarding an overabundance of camping and or trespassing. I attended that navigation center, their board meeting on Tuesday of this week. Tuesday of this week, 2 days ago. And Lieutenant Sullivan from EPD was there. And Lieutenant Sullivan was really helpful in pointing out that that there is an increase around the cities of I'll just categorize it as loitering. It's more than just loitering. And loitering is not a good characterization, that's the term I'll use. And it's in no small part because some camps have been closed and the people have been relocated. But what I can attest to is that the people who are causing the issues in the community generally are not from the navigation center. It is because of the navigation center that those people are able to live more stably and navigate toward permanent housing. 72 beds in the navigation center that we're going to continue to fund. A lot more on that, and we'll hear more on that on Tuesday also. So navigation center, stabilization center.
Did we have anybody from other communities for update?
I don't think so. Maggie had to hop off a little early. I know she often has Florence news, but well, Mike is here. I don't know if he wants to talk about Cottage Grove at all, or
Thank you. Mike, were you coming off?
Sorry about that. Yeah, we don't really have much going on. I mean, budget, of course, is, as Commissioner Farr mentioned and you all mentioned, very, very short. We're going $80,000 into reserves to balance our budget this year. And, of course, we're waiting to see if CSBG and LIHEAP survive. So no, it's pretty difficult. There's really nothing more I can offer than we're just doing our best to keep our doors open at this point and hopeful that things will change. We're grant writing like crazy. It's a tough way to live, but we've been doing it for the last couple of years and we've been fairly successful. So that's kind of it for South Lane County. Sorry to be a bummer.
Thank you, Mike. All right, and then with that, James, you want to talk about the August agenda?
Yeah, so I think, I think we have identified moving forward with the ad hoc committees that have been suggested. So I think in the August meeting, really looking to hopefully formalize, I think, a work plan for those committees. I know, Reagan, again, I think your input was, or your point was a good one. I think bringing what we have to committees will be valuable. Ultimately, these committees, the majority of them will need to be created. And I appreciated that Kim, put in the chat an eagerness to participate. And I think we really would be looking to board members to participate in those committees as much as they're able. So, yeah, I think we'll just look to formalize the committee and work plan in our next meeting. Carly will be back, has come back from maternity leave, and so she's going to be presenting on an HMIS fee policy. And then we hopefully likely will have the formal release of the NOFO, and so Amanda can go over any of that information when we have it. A piece I wanted to mention that I brought up earlier about the joint HSC PHB meeting. So we're looking in October to have Elaine Walters from the Trauma Healing Project do trainings with the HSC and the PHB separately, and then have a joint meeting of the two, really to just look at how those entities and boards can be more trauma informed in structure, in decision making, thinking about how many additional lived experience seats and folks we now have as a part of the PHB. It seemed especially important to just look at how the board can be more welcoming and more aware of just trauma-informed factors. So and this is a conversation I think for the chairs and I to have, but likely we would not have the regular October PHB meeting and instead would have the PHB training with Elaine on October 3rd. And then the PHB and HSC would have a joint meeting. I believe it's October 17th. I will note that we did not, historically the PHB does not meet, I think, in July or in August, and we did have, and we are planning on meeting both of those months. So this technically isn't losing an additional meeting. We usually meet 11 months out of the year. So anyhow, more information on that to come, but just wanted to throw that out there as we look towards the fall. And the hope really would be that we would have, fully have the committees and work plans in place and ready to go by like the end of the September meeting. So, question here. I don't know if that's a question for me or you. I don't know who you're talking about hiring exactly, Chris. Hiring of county staff?
Anybody who, like, at one point we had the lovely Miss Sarai Johnson, who was our housing czar. We have sometimes housing first, but housing management folks overseeing homeless plans and things of that nature. So if we have new negotiations or considerations, if the vendors and contractors are missing a certain level of oversight that would help them be better providers to this community, are we allowed to this body to make a recommendation of that? Because I've been told sometimes our recommendations are not in our purview. And so I'm not sure what we're supposed to do if we do not feel as served as we could be.
If I may, I'm still a little bit lost in the question. Are you suggesting that Mokra High Ski look at hiring somebody specifically to regarding the strategic plan, or that we add a FTE? Is that what you're suggesting, Chris?
Both of those are viable. I just want to know a pathway if we are allowed to make a suggestion after looking at our strategic plan, looking at currently met and unmet needs, and looking at our 5 to 10 year goal. I feel sometimes with negotiations, we need more FTE. Sometimes with negotiations, we are downsizing some of our groups or merging certain groups. I just know that just because someone has a specialty in the broader HHS does not mean that they have a specialty on the ideas that we are currently trying to implement as a community. And I'm open to putting this in writing to someone directly if someone wants to help me navigate the system. As in previous times, talking about mental health for homeless people was deemed not in our purview. And so I just want to make sure that I'm on the right page.
I'll just generally say that policy recommendations, not just to the Board of County Commissioners, but also to City of Eugene and City of Springfield and other municipalities, are a part of this committee's purview. So yeah, I look for policy recommendations, absolutely, not just from this committee, but from our other both intergovernmental and multi-jurisdictional committees, Chris.
Thank you, Madam Chair, Mr. Vice Chair, and Mr. James Ewell.
Regan, did you have?
Well, I was just wondering if, making a suggestion for a priority, and I think what Chris is describing could potentially fit under something like the provider training and program policy work group. And once we have a work group, if you have thoughts on things that work group should consider prioritizing, that would seem like a good venue. In writing, yeah, so that group can consider it along with the other strategies.
Yeah, that makes sense.
Any other comments before we wrap up? Questions about the agenda? Okay. Oh, we are going to get out of here early. We had a very robust conversation considering there's only a handful. Literally maybe a handful of us here today. So I want to thank everybody in person and online who joined us today and who participated in the conversation. And so I know for wrap up, you guys will be back again, probably to give us some more details about funding and the NOFA. We've gotten the feedback around the ad hoc and the committee groups, and so we're going to take that back to the board next month to talk about that being created. And did I miss something? Oh, and then we talked about the potential strategies of moving forward, of being able to look at which committees, how the committees can take the strategic plan into their groups, and then also having that big umbrella of looking at each year what we're going to do financially, what we can look at administratively, and kind of have a more clear report that we could give out to the community about what we know that we can focus on and move forward on based on all the resources that are available.
May I just add one last quick note, a reminder? This is the one committee that the BCC finds important enough that we do broadcast on Metro TV live and repeat and rebroadcast of this meeting, of all PHB meetings. So it's you're on TV right now if you're here. You're on TV if you're in the meeting in any way, and you can watch yourself. But the point I want to make there is that I'd love to see more people sitting around this room. And if me buying food for everybody is what it takes, I will do that. So for the future, look forward to seeing everybody.
We do have free parking in our building, so.
That is true. So, and then we'll soon, wow, it's going to be August already.
Sure.
Summer has flown.
Yeah.
And I do want to give a shout out and remind everybody, because it has been so warm, that on the county website, they have a lovely resource page about resources that are available for cooling centers all throughout Lane County, not just Eugene and Springfield, but other areas as well, and some information on how to keep yourself cool and signs that you may be getting overheated. So please ask that if you have access to a computer or agencies to kind of print those resources and have those available for folks. And that LTD will give free bus rides to folks during these heat advisories to the cooling center places, correct?
If the cooling centers are open.
Yes.
Then LTD was similar to Egan.
Yeah.
If there's an activation of a cooling center, then LTD will provide transportation. And I did, one piece that actually related to that came up was, there was a question around pets and belongings being able to go on LTD buses for transportation. And they were able to work with St. Vincent de Paul so that the St. Vincent de Paul shuttles, LTD drivers will call St. Vincent de Paul, who will then take their shuttle to pick up folks that have pets or in excess of belongings. So although they won't be able to go on LTD buses with the animals or the belongings, we will be able to facilitate that. I can pass that along, Chris, to folks. I think that's it.
And with that, once again, thanks everyone, and meeting is adjourned.